this particular meta-analysis looked at two of the most powerful regimens that we use for newly diagnosed multiple myeloma, namely Dara-KRd or Daratumumab that is added to Carfilzomib and Revlimid, compared to Daratumumab added to Bortezomib and Revlimid. And those are, again, two regimens that we use pretty extensively for newly diagnosed multiple myeloma. And we had many trials that looked at these, but never in a head-to-head trial comparing those two regimens. And both of them are listed as recommended for newly diagnosed multiple myeloma. So we did this study to kind of look at those two regimens and if there is a particular preference in terms of two main objectives, the safety and the efficacy of these two regimens. In terms of the efficacy, in the first period, right after the induction, there was a preference for Dara-KRd showing higher rates of MRD negativity, actually reaching to twice more than Dara-VRd. But that didn't persist until the end of the study period. We noticed that MRD negativity ends by the end of second or third years. It becomes almost the same between both regimens. Similarly, the overall survival was the same. However, progression-free survival was favoring Dara-VRd by the end of the study period, which suggests multiple things. It could be that both regimens are very, very effective against myeloma, and that is a given. But also, it also has some implications with regards to the maintenance therapy that we use after the induction regimen, and we discussed that in the paper that will be coming forth. In terms of the safety, actually, the regimen Dara-KRd was the favorable regimen there. There was lower rates of treatment discontinuation. There was lower rates of grade 3 adverse events, lower rates of serious adverse events, and overall a better safety profile, which all in all, if you put it together, it suggests that both regimens, again, can be used. The choice should be based on the patient's preference for what's the goal of their therapy. Is it maximum efficacy or safety? And that's what we argue in our paper.